Why your resting heart rate matters more than you think. Introduction. Resting heart rate, RHR, might seem like a simple number, but it offers powerful insights into your cardiovascular and overall health. Defined as the number of times your heart beats per minute while you're at rest, your RHR reflects how efficiently your heart functions and how your body responds to various physical and emotional demands. As we age, keeping an eye on this key health metric becomes even more important. By understanding what your resting heart rate says about your well-being, you can make informed choices that support longevity, vitality, and heart resilience. Understanding resting heart rate. What's normal and why it matters. According to the American Heart Association, AHA, a normal resting heart rate for adults falls between 60 and 100 beats per minute, BPM. However, a lower rate, especially in physically active individuals, is often a sign of good cardiovascular health. Elite athletes and those with high aerobic fitness frequently have RHRs in the 40 to 50 beats per minute range due to a more efficient heart muscle that requires fewer beats to circulate blood throughout the body. Why does this matter? Because your RHR is more than a snapshot. It's a reflection of how hard your heart must work while your body is at rest. A lower RHR typically means your heart is stronger and more efficient. Conversely, a consistently elevated RHR, especially in the 80s or 90s BPM range, can be a red flag, indicating increased risk for hypertension, cardiovascular disease, obesity, and even early mortality. What influences your resting heart rate? Several internal and external factors can impact your RHR, including physical fitness. Regular aerobic exercise strengthens the heart muscle, allowing it to pump more blood with each beat. Stress levels. Chronic stress increases sympathetic nervous system activity, which can keep your heart rate elevated. Sleep quality. Poor or insufficient sleep places added stress on the body and can drive up RHR. Medications. Drugs like beta blockers can lower heart rate, while stimulants, including caffeine and some decongestants, may raise it. Hydration and body temperature. Dehydration and fever can both elevate your resting heart rate. Age and hormone levels. As you age or go through hormonal shifts, like menopause, your RHR may rise slightly due to changes in metabolism and circulation. The link between RHR and lifespan. Dr. Joseph Ebinger and other cardiovascular researchers have emphasized the connection between RHR and long-term health. Numerous studies have found that individuals with a lower RHR tend to have better metabolic health, lower blood pressure, improved insulin sensitivity, reduced inflammation, a lower risk of sudden cardiac events. A 2020 study published in the Journal of the American College of Cardiology revealed that individuals with a sustained RHR above 80 beats per minute had a 40 to 50% higher risk of death from heart-related causes compared to those with lower rates. This relationship underscores the importance of monitoring RHR as part of a holistic approach to wellness. How to measure your resting heart rate. The best time to check your RHR is first thing in the morning, before getting out of bed and while still lying down. To do this, find your pulse. Gently place your index and middle fingers on your wrist, radial artery, or side of your neck, carotid artery. Count the beats. Use a stopwatch or timer to count the number of beats in 60 seconds. Track it regularly. Keeping a journal or using a wearable device can help you monitor changes over time. If your RHR consistently falls outside the healthy range, or if you notice a sudden change without an obvious reason, it may be worth discussing with a healthcare provider, especially if accompanied by symptoms like fatigue, dizziness, or shortness of breath. Simple ways to lower your resting heart rate. Naturally, improving your RHR doesn't require intense training. Small, sustainable changes can yield significant benefits. Engage in regular cardio. Brisk walking, cycling, swimming, or dancing 3 to 5 times per week supports cardiovascular strength. Practice deep breathing or meditation. Techniques that activate the parasympathetic nervous system, like diaphragmatic breathing or heart-math coherence exercises, help reduce heart rate and promote calm. Get enough sleep. Aim for 7 to 9 hours of restorative sleep each night to allow your body to recover and regulate autonomic functions. Stay hydrated. Dehydration can elevate heart rate. Drinking water throughout the day helps keep it in check. Limit stimulants. Reduce caffeine, energy drinks, and nicotine, all of which can raise your heart rate. Eat a heart-healthy diet. Focus on whole, unprocessed foods rich in fiber, omega-3 fatty acids, magnesium, and potassium to support vascular health. Conclusion: your resting heart rate is one of the most accessible and telling signs of your cardiovascular health. Tracking it consistently provides a window into how your body is responding to stress, lifestyle, and aging. A lower RHR is generally a sign of a stronger, more efficient heart, and can even predict a longer lifespan. By taking proactive steps to improve your RHR through exercise, stress management, and supportive nutrition, you're investing in one of the most essential aspects of long-term wellness, a resilient, adaptable heart.